Hello guys, Dr. Blackman here. We're going to take a look at the stomach, right? The stomach model, part of the digestive system. So again, follow me with your lab student handouts so you know what you're responsible for. Okay, so stomach here, isolated. Okay, a couple of landmarks that are important. This part out here is called the greater curvature. Okay, that's mainly important to radiologists and surgeons because it's sort of a landmark. You can refer to other structures sort of relative to the greater curvature. So if that's the greater curvature, then this would be the lesser curvature. Okay, and obviously this is the anterior portion, and this would be the posterior portion. Okay, superior up here, inferior down here. Okay, the structure that carries its contents, right, food and drink generally, into the stomach, that would be the esophagus. So we're seeing the very last portion of the esophagus before it goes into the stomach. Okay, the sphincter here, right, the muscle that separates esophagus from stomach, okay, it has three separate names. You can call it either one. The first one is the lower esophageal sphincter, okay, because it's at the lower portion of the esophagus. And the other name for that is the gastroesophageal sphincter. Gastro referring to stomach, esophageal referring to esophagus. The other name for that is the cardiac sphincter, okay? I don't like to use that one because it kind of makes reference to the heart. The reason for that is that if you have issues here, you can have heartburn. That's one of the reasons. The other reason is because this portion of the stomach is called the cardia, which we'll talk about in just a minute. So here's the last part of the stomach before emptying into the small intestine, right? The first part of which would be the duodenum or duodenum. Okay, that sphincter there, that muscle that regulates the movement of that kind from stomach to small intestine, okay, that's called the pyloric sphincter. Pyloric sphincter. Okay. So if we take this portion off, we can see some of these internal structures better. Okay, so again, greater curvature, lesser curvature, the sphincter, three different names: gastroesophageal sphincter, or lower esophageal sphincter, or cardiac sphincter. And then this, see the muscle there, right, very thick muscle, that's the pyloric sphincter. Okay, by the way, sphincters at rest are going to be closed. Right? You actually have to send messages to those sphincters to relax and open up because at baseline they're closed. Okay. The parts of the stomach, or regions is probably a better word to use. The regions of the stomach, this would be the cardia. Okay. This portion here would be the body. Okay, so the body kind of makes up the majority of your stomach. This portion here is called the fundus. Okay, just like the fundus of the uterus is sort of that top portion, and it's very clinically relevant when speaking about the uterus. So the stomach also has a fundus, this area here. Okay, then the last part of the stomach before you get to the pyloric sphincter is going to be your pylorus, okay? And it's spelled differently than pyloric, okay? So the region is the pylorus, P-Y-L-O-R-U-S. The sphincter is pyloric, P-Y-L-O-R-I-C, okay? The last structure that I want you to be aware of, these are called the rugae, R-U-G-A-E, right? Remember, in Latin, if it ends in A-E, it's pronounced E, like chordae tendineae, rugae. You can even think algae, okay? If it ends in A-E, it's pronounced E. So these structures here, these mucosal folds that allow the stomach to get very, very large when it distends with food or drink, right? These rugae allow that to happen, okay?